You know, there's a sound that can send an absolute chill down any parent's spine, and that's a sudden, harsh, barking cough in the dead of night. Today we're going to pull back the curtain on this childhood illness called croup, so you know exactly what it is, and more importantly, what to do.
It's a sound you really don't forget. One minute, everything's quiet, your child's asleep, and the next, they're sitting up with this shocking, loud, seal-like cough. It's definitely scary, but understanding what's actually happening inside their little body is the first step to knowing how to respond calmly and correctly. So what is this thing called croup? Well, at its core, it's an infection, almost always caused by a virus, that makes the area around the vocal cords and the upper airway swell up. And it's that swelling, that narrowing of the airway, that creates that signature barking sound. It also causes a high-pitched whistling noise when they breathe in, which is called stridor.
Okay, so the key to managing croup isn't just knowing what it is, it's knowing how to figure out how serious it is. Is this a mild case you can handle at home, or is it something that needs a doctor right away? Let's break down the signs that'll give you the answer.
This table right here, this is your guide. It's your roadmap for figuring out what's going on. We're going to focus on 4 key things. First, the sound of their breathing, that stridor we talked about. Second, the effort it takes them to breathe. You can see this when their chest pulls in. Third, their overall state. Are they alert or are they kind of out of it? And finally, a really big one, we're looking for any bluish tint to their skin, which is called cyanosis. These 4 things together paint a really clear picture.
All right, first up, let's talk about the most common scenario, mild croup. This is often something you can totally manage right from home as long as you know what to look for and how to react.
So in a mild case, you'll hear that barking cough for sure, and you might hear that stridor, but, and this is the key, only when your child is crying or really worked up. Crucially, their chest isn't pulling in with each breath, and they're alert and acting pretty normal otherwise. The response here is all about comfort. Keep them calm, make sure they're drinking fluids, and a doctor might prescribe a single dose of an oral steroid like dexamethasone just to help bring that swelling down.
But what happens when the symptoms start to get a little worse? Well, that brings us to moderate croup. And at this stage, just watching them at home isn't enough anymore. It's time to get a medical opinion.
The absolute game changer here is that the stridor, that whistling sound, starts happening even when your child is calm and at rest. You might also start to see their chest pulling in just a little bit. That combination is your signal to head to the doctor. They'll likely want to observe them for a few hours after giving them that oral steroid. If things calm down and they're back in the mild category, they can usually go home.
Now, we get to the most serious level, severe croup. The signs here are not subtle, and they mean you need to act fast. This is a true emergency.
This is the trifecta. This is the critical combination that screams severe croup. The stridor isn't just on and off, it's constant, even when they're resting. The chest pulling is significant, you can really see them working hard to breathe, and the most important warning sign, you see cyanosis.
Let's be perfectly clear about this one. Cyanosis is a visual sign that your child is not getting enough oxygen, period. You'll see a bluish color around their lips, maybe on their skin or in their fingernail beds. If you see this, it's a real medical emergency.
In a hospital, that visual sign of cyanosis translates to a hard number. It means their oxygen saturation level has dropped below 92%. It's the data that confirms the body is in distress and desperately needs oxygen support right now.
When a child presents with severe croup, it triggers a fast and aggressive response. The team immediately gets them on high-flow oxygen. They'll give nebulized adrenaline, which works really fast to open up the airway, along with more powerful steroids. Specialists are called in, and they start preparing for a potential move to the ICU, just in case they need to protect the child's airway.
Okay, so beyond that mild to severe scale, there are a few specific red flags you need to have on your radar, especially if you've been sent home from the hospital. And we also need to talk about a rare but very dangerous condition that can sometimes look like croup.
If you get sent home after a moderate case, this list is your go back to the hospital now guide. Things like drooling or not being able to talk mean the swelling is so bad it's affecting basic functions. And extreme tiredness shows their body is just exhausted from the effort of breathing. If you see any one of these, don't wait. Go back for help immediately.
This brings us to a really critical question. The vast majority of the time, a barking cough is croup, but there's a dangerous mimic that doctors are always trained to look for.
It's called epiglottitis. And right away, here's the difference. This is caused by bacteria, not a virus. It causes really fast, really severe swelling of the epiglottis. That's the little flap at the back of your throat, and it can swell so much that it completely blocks the airway, making it a life-threatening emergency.
This is one of those classic medical phrases that perfectly describes what to look for. When doctors say toxic, they mean the child looks incredibly sick really fast. They're pale, listless, just seriously unwell. And the potato muffin voice? It's a key clue. It's this muffled, thick sound, almost like they're trying to talk with a mouthful of food. It's completely different from the sharp bark of croup. So let's put them head to head here. Croup is viral with that sharp bark. Epiglottitis is bacterial with a muffled voice. But honestly, the biggest giveaways for epiglottitis are that toxic appearance and drooling. Drooling is a massive red flag because it means it's too painful and difficult for them to even swallow their own saliva.
And here is the really good news. Because of the routine Hib vaccine, epiglottitis is incredibly rare these days. But because it's so dangerous, every medical professional is still trained to spot those signs, just in case.
So from that very first mild, barking cough all the way to the red flags of a severe emergency, understanding the whole spectrum of croup is really about empowerment. It's not about getting rid of the fear. That's impossible. But it's about replacing that fear with a clear plan. Knowing what to look for, what to listen for, and when to act, that is the absolute key to navigating this safely and confidently.